Right. Looks like we are ready to go here. I want to thank everyone that made it in today to the call. Good morning, everyone. My name is Reese Orman. I'm the CEO of NeuroGlow, and with me today is just a really amazing person, Trevor Bidstrup, who does all of our preparation and integrative therapy for our patients here at NeuroGlow as they start their journey down ketamine-assisted therapy. And as Thrive members, we get a really unique opportunity. First of all, I want to thank you for being part of this program. It's very exciting to get this off the ground and have such active participants in this healing journey. But as we as we get to work together, we get these opportunities to do these deep dives and really focus in on some of these things to get the most out of these journeys. And today, I think Trevor's going to be sharing a lot of really useful information. So please, as we go through this, if anyone has questions, just throw those in the chat here. We do have a Q&A at the end. And with that, I will hand it over to you, Trevor.
Awesome. Thanks for having me again. For any of those that don't know me already, I'm a therapist, been working with ketamine now since kind of late 2020, early 2021. Originally kind of had my start back in Washington State, and more recently moved down to Dallas, Texas about a year ago. I've been working with NeuroGlow pretty closely. And in thinking about the presentation today, part of what inspired me to select intentions in preparation for the topic was thinking about how usually most patients, when they go through their treatment series, they begin with the initial onboarding, the preparation, kind of all that information that's necessary for treatment. But sometimes after we go through all 6 infusions, or maybe even coming back for additional infusions, that information we got way back when kind of slips through the cracks. And so my hope is for this to be a little bit of a refresher, but more than that, to also be a bit of a deep dive into some specific topics that I think might be useful and interesting, some things that I've been finding really interesting actually in the research too. But more on that later. We'll just kind of jump right in. So if we're talking about kind of the basics of preparation, Timothy Leary really kind of paved the road for this kind of in the late 60s, early 70s with a lot of his research on psychedelics. And he talks about the importance of set and setting. Set referring to the mindset, kind of what's going on between your ears, kind of where your head is at starting treatment. This includes factors related to personality, mood, intention, which we'll talk a lot about, expectation and preparation. And then on setting, that's more referring to the context and the environment around us. This includes things like the physical surroundings, culture, people or social factors around you or that you're thinking about. The date and time, even that can be an important factor. And of course, the atmosphere and what it feels like to be in the environment that you're about to receive the psychedelic experience. I kind of want to start by cultivating the set. This is the mindset. Like, what can you do as you get ready to go for your next infusion to make sure that your mind is in a useful and a place that actually is conducive to insight and growth and psychological flexibility, which are some of the big factors we want from these ketamine infusions. Kind of started off when I was saying personality and mood are 2 big features. These are ones that I think it's important to have an awareness of, and there's a few things we can do to kind of modify and adjust them, but really they're a little bit more kind of concrete. Personality especially so. Personality is the way that we generally approach life and view things. What we can do to kind of aid in creating a more useful set or mindset for us going into treatment would be to practice things like compassion and non-judgment for who we are. It's a lot easier if we move with the grain, so to speak, and kind of realize who we are and where we're at in life right now and try to work from that point than trying to say that where we're at right now is just not okay. And we're not going to be able to start working on this until some miracle happens and I'm a completely different person. Better to start where we're at. A mood is sometimes similar to personality, but it's more fluid. It tends to be more kind of affected by stimulus and kind of things happening in life, which is why I like to suggest before your infusions, try to limit potential stress. I always feel a little bit awkward saying that because if we could reduce stress all the time on demand, I probably wouldn't be meeting with most of the patients that I meet with. But I'm really talking about the small little things in life and trying to avoid them as much as possible. And even more so, trying to focus on things that are grounding and relaxing before your infusion. These factors together can allow us to start getting our head in the right space leading up to that first infusion or the returning infusion if we're coming back for more.
Trevor, I wanted to say that was something that became very apparent to me in terms
Yeah.
of just coming from a kind of high stress work environment. I know that I have to come in fresh to come in to do an infusion, right? And I know that I've got this cadence of some kind of exercise and breathing and some things I can do to set myself up for success. And it's noticeably more effective when I'm intentional
Yeah.
about things prior to going into this is such an intense experience that we should be doing everything possible to set ourselves up for success and the most amount of healing as possible, both during and after, right? So I guess before, during, and after.
Yeah. I'll mention it a little later on too, but this kind of plays into this idea of ritualizing the experience, making it more than just something you drive your car to your park and go in for the infusion and go home, but kind of how can you make the whole day something different than the norm? Like a lot of people might ritualize certain holidays or birthdays or things like that to make the day more special than just any other day. Trying to think about it from that kind of approach can allow us to get even more from the infusion too. And that includes what we do before we show up, as we're getting ready in the morning, preparing to come to the clinic, thinking about our intention. I won't get too far ahead of myself, but all these factors that come into play. Which, speaking of intention, this is actually the part that I was really excited to deep dive into because I think this is an area I've noticed can be a big struggle point for people. And I imagine it's likely even a bigger struggle point if you've been going to, your first infusion was 6 months ago and it's been so long since that preparation call. The point of this is to be a little bit of a reminder and also a bit of a deep dive, kind of focusing on some new research and things that can add more value to us. So what are intentions? I mean, I think sometimes when I started working in this field, I wasn't totally sold on the idea of intentions, if I'm being honest with you. I kind of seemed like a wish, hopeful prayer, kind of like I'm hoping for happiness, which sounds great, but also like, is this science? Is this actually research backed? Is there actually benefit to it? And I think asking the question, do they really make a difference, is valid. I mean, it does seem like it could edge on the side of pseudoscience to some people, but I'm going to kind of bring in a little bit of research and experience that'll hopefully highlight some of the value of intentions. I really like this quote, and I find myself using it often, that intentions, both within psychedelic spaces and in daily life, have been linked to increased goal attainment as well as increased awareness of the underlying processes that are involved. This is an important one, and that awareness point you'll see me bring up again in just a second. That's a really valuable part of intentions. They can give us more insight.
As I read that, Trevor, and was doing a little research before this, I kind of paralleled that the notion of intentions and the outcomes that they bring almost to visualization.
Yeah,
When you look at humans that have accomplished great things, there's a common theme amongst them very often that there's this huge component of visualization that they were able to visualize and almost manifest, and kind of from that outcome back into the things that needed to be done to do that, right?
definitely so. And especially like I think in psychedelic spaces too, where there's it seems like a near infinite amount of possible experiences we could have and ways our mind could wander. Setting out with some kind of goal or like general objective or area that we want to focus on. I'll talk a little about that in a second, but that allows us to kind of take this vast, a million possibilities and hopefully dwindle it down to a few that are the ones that are of high value to us, the ones we really want to deep dive into. I become a really big fan of this metaphor, aiming the cannon. And when I'm saying aiming the cannon, what I'm referring to is the aiming part is like your conscious mind, directing kind of what focus do I want for my intention? Where do I want my mind to be kind of centered in those moments before ketamine takes effect, as a way to then guide where my unconscious mind will wander during the infusion itself. The unconscious mind, it's kind of like the cannonball. It's going to be fired in that general direction. It's going to have its own kind of wanderings, and it might not be exactly spot on, kind of like a cannon would, but we're going to try to get it at least starting in the right direction. You know, it's useful from that point of view as far as what happens in the infusion itself. Intentions are, again, useful afterward when we go to dissect and explore what content came up. It kind of provides context for it. If I find myself thinking about, you know, whatever it is in the middle of my infusion, I can ask myself, what does that have to do with my intention that I started with? You know, is there a link there? Because your mind started consciously in one area and then unconsciously went to another. That's valuable insight. If we don't have that starting point, all of a sudden we have no anchor point, no context with that in which to understand the experience itself.
That that scenario that you just explained right there, you know, for our audience here, that was a place I found myself in as I started going through my infusions. And I was very thankful for those integration sessions with Trevor, where I was able to kind of link these themes, these outcomes that I had in the sessions, and like, what is the meaning between those? What's the significance of those? And how did I feel about that? And that was, thank you for that, Trevor. That was very helpful. But I have definitely, you know, gone in with an intention, and then I am just off, you know, in left field in a completely
Yeah.
different topic. And without being mindful of that, it can be, you know, a little overwhelming. Feel like you're like lost in a maze or something, right?
Definitely. I mean, and kind of we're speaking about our own experiences. You know, I've gone through the ketamine treatments myself too, and gone back for one or two infusions over the years. And I've found that there's been times where, you know, maybe life got really stressful, like work was crazy right before the infusion, something like that. And then I go in and I hadn't spent as much time thinking about intentions before the treatment. And almost without fail, I'll find myself leaving the infusion being like, I don't know what to make of this. You know, like it was maybe like pleasant, you know, interesting, something like that. But do I feel like I really gained a lot from it? Sometimes I'm like, I don't know. It's hard for me to make that connection initially. And I
Yeah.
found the times that I have a very solid intention and maybe even meditated on a little bit before, that's much more fruitful. And I've had a lot of my patients say the same kind of thing.
Cool.
I wanted to bring in some research. It's actually very recent from just earlier this year. It was a study originally on MDMA, but MDMA is another substance that's been used a lot of times for mental health treatments. Now, there's a lot of things going on at the FDA level right now about maybe approving it. But this was the very first study that studied basically what the type of intention was and how that influences outcomes. And it was interesting because this was actually more of a retroactive study. They took people that had basically gone about using MDMA in various different ways, and then they asked them questions after the fact. So it wasn't like we gave them different control groups or things like that. It was just surveying a bunch of people's experience. In fact, it was 886 people. It's a pretty large sample size as far as studies go. And they were studying what degree does socio emotional benefit have as influenced by either self-insight style intentions or euphoric or energy intentions. And I'll explain that in just a second. This is the data, and the way we can understand it is all these shorter lines kind of in the beginning of each of these groups of three, the light blue, those are people that had intentions related to, they labeled it as euphoria and energy. But essentially think about this as like maybe I'm going into intention thinking about love. My intention is love. It's the positive outcome that I wish to achieve. And that's what my intention is going into it. Almost like a wish or a prayer or focusing my mind on the thing that I want the most. And you can see when it comes to outcome scores, higher is better on this scale. They're actually the lowest scoring across every single level: social confidence, friendship quality, emotional reflection, positive worldview, all of these areas, it's lower. The highest scoring one, the one in the middle of each of these, kind of the dark blue line, those are people that had intentions related to self-insight. They didn't want the positive thing. They wanted to learn about themselves so that they could then later get the positive thing. Instead of love, it's maybe asking the question, what are barriers to love within myself? Instead of trusting my family, maybe asking the question, when was my trust broken? And how can I repair that trust? It doesn't, you notice I'm using a lot of questions in these kind of intentions. It doesn't need to be a question, but I think if we have those sorts of curiosities in our mind going into it, we could, in theory, use the intention of just love, but under the surface, like in my head, I'm thinking to myself all about love from a curious, open, trying to understand more about myself perspective. instead of man, love sounds really nice and I wish I had it. How can I learn more about myself as a tool? Because that's what we want from these treatments. We don't just want to have the fish, we want to learn how to fish. Like how do we actually get that good thing? That's kind of the kicker here.
So it's somewhat of a parallel, Trevor. One of my business mentors over the years, as we went through a series of kind of coaching calls and working together, he got me really honed in on this acronym for setting goals, called SMART goals. So it's not
Yeah,
like I want to lose weight. No, it's specific, measurable, attainable, relevant, and time sensitive. I want to lose 10 pounds by the end of the month, and here's the means. But having some confines around what that is. It's being more intentional with your goal setting, right? And this graph was really compelling when I looked through this to see how much the results. And I think a lot of us, and I've done this myself. It's like we're right there. We're knocking on the door of that kind of self insight, kind of
yeah,
reflective, right? But maybe we're just not there. So I'm really glad that we're getting to talk about this today, because when you can get to that level of introspection in these infusions, it's amazing what can come out of them, right?
yeah, definitely true. And for anybody that maybe has been looking at this, wondering what the white line is, the one all the way to the right of all of these sets of three, the white line is actually, they call it mixed. So it's kind of like a bit of both, a bit of self-insight and a bit of euphoria and energy wishes in this case, kind of that positive feeling. And although it's still pretty high, certainly much higher than the other one, it's also not quite as high as insight alone, which I think kind of even further drives it home that the value of going into these experiences with the goal of insight and self-reflection and learning about ourselves as being the most long-term benefit outcome we can get. Like that's what we want to shoot for. Specifically, as we look at it too, let me see if I can get this to work. Oh, there we go. There was four categories on this that actually had a 50% greater. Like it was literally twice as good to go in with insight compared to go in with wishing for euphoria energy. Things like better emotional reflection, increased compassion, deep emotional experience, increased positivity is the one below the captions popping up right now. Those areas are hugely important for therapy. I mean, they really kind of describe the therapeutic process in many different ways. And so, especially if we're going into this with the goal of learning and growing and improving our emotional health and well-being, these are the things to really dive into is how do we get insight about ourselves? So let's talk about like how do we actually make effective intentions? The data is interesting, but how does this translate? How do we actually apply this to our own treatments and our own lives? Effective intentions involve self-reflection. They involve emotional depth. They can involve curiosity and healing. There's a bunch of different ways kind of listed below each of these words that are kind of carried out. But the curiosity aspect is one that I see echoed in research all over the place. I want to go in there curious to learn. If you go in there being like, I figured it all out, I know exactly how everything is, I'm just going to, shoot for the stars and hope that I feel happy, but I'm not willing to change anything about myself or my perspective, it's not going to go too far. I mean, even when I start to say this out loud, I imagine some people are like, well, yeah, of course, it sounds pretty obvious, but having that curiosity and trying to cultivate that as part of the way you're going into this experience. Like today, instead of I want to leave feeling happy, maybe instead say today I want to just learn something new about myself. I want to get one new nugget of information that when I chew on it for a while, maybe that'll lead to self-growth or at least a deeper understanding of who I am, what matters to me, and how I want to go about life. That's kind of the big thing we want to shoot for. I made some examples. These are actually ones that I've heard patients in the last year or so talk about, and I kind of found ways that maybe we can tweak it in small linguistic differences to maybe get a little bit more out of it. It's like a less helpful intention might be, I am happy, healthy, and content, almost like an affirmation. I'm trying to focus on that good thing. Instead, maybe we could ask, well, what matters most to me in life? What makes life meaningful? What's really going to drive me to feel happy, healthy, and content? What stuff I should dive into? Instead of saying, I want to get over my ex, which makes sense. I think that's a pretty good intention for a lot of people. We could make it even better by saying something like, well, how has the divorce hurt me? And what does healing look like moving forward? What do I got to do? What does this path include? There's a few other ones here. I'm not going to necessarily read through all of them, but I think it might be interesting to reflect on it a little bit. And you notice the common trend across all of these is that instead of shooting and aiming and phrasing it around the goal, it's how can I learn about the process leading to that goal? Kind of like how Reese was just saying with the SMART goals. Instead of just saying, I want to make $100,000. It's okay, like how do we make this specific, measurable, attainable, like all of these steps to actually know we're moving in that right direction and make it more approachable, more defined. This is something that I covered with everybody as they were starting their infusion series, but I think it's helpful just to kind of bring up some of the basics of preparation. We already talked about a few of the psychological things under mind, like establishing intentions. We just went pretty deep into that, limiting small stress, meditation, journaling, all of those things are helpful. On the bodily side, no water 6 hours or 2 hours before, because ketamine does process through the body and is expelled from the body via urine. And then no food for 6 hours before, just because we want to reduce the chance of nausea and vomiting at the clinic. Stimulants, in case you forgot, it's one that there's not actually much of a medical risk, but there's a lot of research and a lot of my experience pointed towards that they tend to blunt some of the psychedelic effects of treatment. This is especially relevant for people that maybe are taking a late afternoon infusion appointment, have been working all day. If you drink coffee or any kind of caffeine intake during the day to make it through your work day, that might be impacting your infusion a little bit. I'd encourage you to try to limit those stimulants before, or else take them very early in the day so that they're out of your system by the time you come into the clinic. They can also influence blood pressure too, which can be a medical concern. And then benzodiazepines, things like Xanax and others, those can also blunt some of the psychedelic effects too, if they're taken right before. I should mention that I am a licensed mental health counselor and not a medical doctor, and this is information that's been passed on to me by the ones that actually are allowed to talk about it.
Trevor, the what you mentioned earlier, I was thinking about as you said, that ritualizing of those days. I've myself found like, when I'm coming in, if I'm doing a booster infusion, I'm very intentional about having a calm day. I like doing them kind of mid-morning so that I can get out of it, maybe grab a bite to eat and rest for a while, right? But having this very set cadence to it and being kind to yourself on those days, because even after that infusion, that next 24 to 48 hours, there's going to be a lot going on in your brain, right? New neural pathways are being carved out. There's, your perspectives on things are literally changing during that time. And so,
Definitely true.
For those of us that, I'm sure many of our members have busy lives with jobs and kids, it's hard sometimes to balance that, but making that time for yourself and having a support system around you that'll allow you to have a smooth morning and recover and rest, everything really crucial to the outcomes here, and definitely worth a conversation, I think. Just so that you can get the best outcome from these incredible experiences.
Yeah, I completely agree. I mean, I've even had somebody before talk about it as like, on your wedding day, it's not going to look like every other day of your life. It's a special day to you, which means you're going to do special things, maybe say no to certain things, say yes to others. I'm not saying that it needs to be as important as your wedding day every time you come for an infusion, but I think that's an interesting comparison, to think about like, how do we make special days special? And when we know something special is happening, what does that lead us to do? And kind of can we apply that sort of a situation over our ketamine treatments? But the last part, I guess, of setting your headspace right going into these infusions is to have realistic expectations. In a perfect world, I'd say go into all your treatments with no expectations, but nobody invests this much time and money and all of this stuff without some degree of expectation. It'd be kind of strange if you had absolutely none, as much as I wish that could happen for all of us. This is data that came from the ASKP3, which is the American Society of Ketamine Practitioners, Providers, and Psychotherapists, I think are the three Ps. Been a part of it for a while now. I'm on their therapist advisory panel. This is their data, nationwide level data. And the way that they talk about outcomes of treatment is they say it's a 30-40-30 split, where essentially 30% of people, after one or two treatments, they're going to have a significant response. What that means is symptoms are cut by at least 50%. So if you started filling out a score of 12, that means you're going to be at 6 after one or two treatments for about 1/3, 30% of people going through it. The next 40% will get that same benefit, but it might take up to the entire 6 infusions. It might take a little bit longer, but it'll be achieved by the end of your treatment series. And then the last 30% are people that have a lesser than 50% change in symptom presentation after all 6. Now, what this translates to really is that according to ASKP3, there's a 70% chance that this treatment's going to work. It's going to cut your symptoms in half by the end of 6. Even better than that is that NeuroGlow, we've been noticing about 82% of people. So we're getting like 12% above this nationwide average presented by the ASKP3. And it doesn't feel like an inflation of results at all. I mean, I've been working with a lot of these people. This is literally what I'm seeing happen in front of my eyes. And so I guess my hope is that with this knowledge of outcomes and what we can expect from it, we can feel a little bit optimistic too, a little bit kind of open and curious. And I'm like, this has a pretty strong chance of working. What happens if I lean into that? If I trust that it's worked for so many people and I'm going to stay open to it. I'm going to be curious. I think it's a very different headspace to go into it being like, there's no way this is going to work. I'm kind of resistant. I'm going to be a little bit more rigid in thought, less flexible, less open. My hope is that with this data that is genuine, that it can also lead to you genuinely being a bit more open and curious in the treatment too.
That is very wise words. The set side of this equation really has a lot to do with the patient, right? They really have to put in the work to make that side of the equation meaningful. What this data is showing everyone here is that, like, from a setting perspective, I want you to know that we go above and beyond to make sure that we've got the proper setting when it comes to a comfortable environment to go on this journey. And most importantly, like getting just a profoundly empathetic staff that will support you through this journey and see to it that you are healing. And so that was something that, coming in as a patient myself in December of this last year, that was remarkable for me, was seeing the level of empathy and compassion that this team had, and the profound nature of these experiences and the healing journey it took me on brought me into this business and into this industry, and I rededicated my professional career to this space, because it is every time I go into one of these infusions, Trevor, I come out of it thinking, like, I cannot believe more people don't know about this and that it's an option, and
Yeah.
what this is like. Every time it's just reaffirming of the stories that we hear from our patients, right? And so, on that note, if anyone, that's listening to this call, whether live or recording, if there are things we can do at NeuroGlow to make that journey more comfortable for you, more appealing, please let us know. We're very open to any kind of suggestions in that regard. But it is it is our goal that we set you up for success, both from the kind of set side and setting. So just keep that in mind.
Same is also true on the mental health side as well. I think there's sometimes a fear in people that come for counseling to say, I don't know if this therapist is quite right for me, or I don't know if I'm completely, vibing or resonating with therapy that's going on. If that happens, I mean, I think I can speak on behalf of NeuroGlow here that all of us are here because we want people to get better. Like, that is our end goal. And if it means changing the provider that you're working with, if it means changing the lighting, if it means changing like anything related to setting or things that are under our control, I'm confident that all of us would want to do that thing to make your experience better at the clinic too. Reese already kind of mentioned a few of them, but when it comes to like the key elements of setting, this is probably maybe a bit of an oversimplification, but some of the big things that are at least the fore of people's mind would be medical factors, like the staff itself. Do we trust them? Do we trust what they're doing? The dose, which I'll talk a little bit more about in a moment. The environment you're in, so like that includes the comfort. Maybe it's a bit chilly in the clinic. Do you have a blanket? This also includes the day and time. If it's an anniversary of a loved one that passed away, maybe it would make sense to do it the day afterward. If we find ourselves being more mentally awake and active in the morning, yet we're always doing evening infusions, maybe it'd be worthwhile to try a morning infusion. Time of day is also a big factor. The atmosphere, this includes things like your visual and auditory inputs. That's going to be the music you're listening to, which I'll talk a little bit more about how might change that. And then the presence of an eye mask. Some people might feel more comfortable initially not using an eye mask, and that's totally fine. I would rather you gain that comfort and confidence than force yourself to wear an eye mask initially. But if you've been going to them for a while and finding that you're not getting as much from it, maybe consider using an eye mask. That might be a useful tool to use during your treatments. And then it can't be mentioned, and sometimes it's forgotten, but aftercare, like what do we do after the infusion? That is still your setting when you get home. It's not just about the clinic. It's about what are you going home to as well. And is there a space and a tone that allows you to rest afterward? And it's conducive for integration and journaling perhaps too. I figured I would summarize all of this really quick, and then we can kind of switch over to question and answer with a few kind of recommendations, things that as somebody myself that's gone through additional infusions beyond the series, and that I've worked with countless people going for additional infusions beyond their series. This is some recommendations specific to you guys, the ones that have gone through it and are coming back for a booster, or you're considering some kind of maintenance protocol. First and foremost, do not lose sight of how important intentions are. I'm going to push even extra hard to journal a little bit before. The value of journaling, and the only thing that's convinced me of the value of journaling has been understanding that when we write, we're forced to slow our thoughts down because we can only think as fast as we can actually put the pen on the paper. Our mind, without pen and paper, it can move a mile a minute. And sometimes it can jump around so much that we don't even focus on specific ideas. So that's the value of journaling, is to slow the mind down to the pace of what you can write with your hand, to really chew and savor, these important ideas that are going to lead up to our intentions for each treatment. Semi-related to that is music, actually. Usually for the start of treatment, we go for music like Floating Through Space or something similar. That's a lot, I might call it emotionally neutral, like it's not particularly emotional in any strong way. But as we continue going through infusions and we get more comfort and security with the process, that can be a time where we might introduce small amounts of emotion to the music. Specifically, there's a lot of research that goes, if we can make emotions aligned with our intentions. So for example, if I was saying, I'm really trying to figure out why it's been hard to forgive myself after this difficult experience. I know that it would be helpful if I did, but I want to try to find forgiveness for myself here. Maybe having music that starts a little bit more bittersweet, more emotional, capturing kind of the difficulty of not having forgiveness, and then transitions into a bit more affirming or positive kind of style music that's a little bit more lighthearted. That might be something that could kind of help facilitate your natural thought progression during the infusion, moving from that place that we are now and ending in a different place. It seems a little bit silly, but music really does influence this experience. And it's one of the guiding factors we can use to get even more out of the treatment. There's a whole list of different music suggestions that I send to my patients, as well as the ones that are already at the clinic. You can even create your own music playlist too. That can be a great way to prepare for your infusion, is to put maybe an hour of different songs or things like that, knowing that your treatment's 45 minutes, but put a little bit extra, just to kind of allow for you afterward as you're returning back. Now, that can be one important factor, one thing you can do leading up to your next treatment. We already talked about ritualizing. I can't emphasize this one enough. How do we make today special and unique from every other day? I feel like we've talked about it a bit, so I'm not going to spend too much time on it now. Ritualizing is an important factor I definitely encourage and recommend. Dose. This is one that I'm not going to talk a whole lot about because it really is, I think, best handled by NeuroGlow and the trained staff that provide the medical treatments. But what is your sweet spot, so to speak, with dosing? We tend to notice this pattern where with a higher dose of ketamine, we get a deeper experience, but less memory of the experience itself. It's almost like we have a scale, and as we have a deeper experience, when I say deeper, I mean maybe it's more visual in nature, maybe my mind is more stimulated, maybe I'm feeling more emotionally than I did at a lower dose. But in exchange for that depth, we tend to lose memory of the experience a little bit. And on the very far end of the scale, which would not really happen at the dosing levels that we have at NeuroGlow, for example, like in operating rooms and more medical settings, people will lose consciousness. I know that's the point of it in an operating room setting. And so that's a complete loss of memory. So we kind of want to find that sweet spot for people. And that can be different for different people at different points in time. Maybe for a while we find a dose of 1.0 milligrams per kilogram to be helpful. And then a while later, we're like, you know what? Actually, I don't know if I need it as strong. I want to remember more of it. Maybe I'll back it back down to 0.8 milligrams per kilogram. That can be another knob that we can turn to kind of change outcomes moving forward. Talked about time of day a brief moment ago. I think most people oftentimes start their treatment fitting it in where they can, where it is easiest for their schedule and going to cause least impact for them. But especially if you're only coming back for like one booster treatment in a month or something like that, consider mixing that up. My actual therapist, when I went through my initial series, suggested this for me because I was trying to put it at the end of my work days, allowing me to take the least amount of time off work. And she's like, you should consider trying one earlier in the morning. And I was like, well, why is that? And her advice was spot on. And her advice was that, well, earlier in the morning, you're more of a blank slate. There's less things that have gone on all day, less potential for stress and worry and anxiety or any of this stuff. You're probably going to go in a little bit more clear-minded than you would at the very end of a long workday. That's an interesting factor that I think a lot of people don't always consider. And that's one I would consider, or I would encourage you to consider, as you go back to schedule additional infusions and things like that. And last is to mix in some creativity. After your infusion, once you get home, the best way to exercise all those new neural pathways is going to be through activities like art, painting, drawing, creative problem solving, anything that engages the creative parts of our brain, because the creative parts are all of it. It lights the whole brain up like a Christmas tree when you do this sort of a thing. And that's going to allow all of these new neural pathways to get strengthened. Strongly encourage people to engage in some kind of creative activities after your treatment once you get home.
Yeah. As you were saying that, it brought to mind, we had a patient come through and do their full series, and a couple of weeks after came by and dropped off a painting at the office that they had done for our team there, for Kelsey. And the patient was telling us, I hadn't painted for so long, and there is a common recurring theme we're seeing, not just in NeuroGlow. I mean, the data backs this up anywhere, that enthusiasm for life, that coming back to things you enjoy. I picked up on that personally myself, and started really getting more involved in kind of physical fitness and kind of overall healthier choices. That kind of push that you can get from these infusions in the right direction. I think what you're saying, Trevor, is really lean into that and try to express that creativity and really galvanize those new pathways that you're carving, right?
Yeah. I mean, it's not for everybody, I suppose, but there is a whole realm of what's referred to as psychedelic art. And I think what makes this whole realm so interesting to some people is that it's individuals' views of what their mind can do. It's an individual perspective. And we talked so much about preparation, about all these factors, environmental, inside your head, external, all of these factors going to influence your unique experience. Nobody could have the exact experience you just had again, because all these factors, they're near infinite. And because of that, it can be an exciting thing to actually try to capture what happened for you. I'm not saying everybody needs to be drawing their infusions or journaling on their infusions, although I think both of those would be very helpful, because nothing will ever be exactly like it was in that infusion. And it can be really interesting to capture that, maybe share it with others too. But I think that kind of brings me basically to the end of this presentation and the key topics I want to talk about. I definitely want to open it up in case there are any questions or things like that from the audience. Of course, if anybody is watching this recorded or at a future point in time, if this presentation makes you curious to learn more or want to ask any questions, shoot me an email, trevor@psychthera.org, and I'd be happy to get back to you.
Thank you so much, Trevor. This was a
Yeah.
very insightful session. I typed a message to the audience here and had a response from one of our attendees. Said, I don't really have any questions, but I do appreciate the information. Well done with the presentation. Trevor is a champ. So I just want to thank our audience member and thank Trevor also for sharing this information. I listened to a fireside chat the other night, Trevor, with Dan Engel, Dr. Dan Engel. And he is a pioneer in this space and philanthropist. And he spoke to a couple of notions that were really intriguing to me. One of those was that, what we are uncovering here. It's first of all, the notion of hardware versus software and the brain versus the mind, right? The brain being the hardware, the mind being the software, right? And
Yeah.
that interplay between those dynamics, we're just now beginning to really understand those interplays, right?
Yeah.
And second notion that he really hit on, that was a real passionate point for him, was that this space that we're in, it is bringing together, piece by piece, science and spirit. These things are getting closer together, right? And it is irrefutable that the psychedelic modalities are therapeutic and create
Yeah.
healing opportunities for people, right? And so, every time I took a quote from that he said, data moves science, stories move culture. And so every
Mm.
time you share how, as a patient that's gone through this, as an advocate for this space, every time you share your journey and make more people aware of this, you are helping move that culture, I think, in the right space. And so it's one of the reasons I became so emphatic about this, is it was life changing for me. And I think that we can help a lot of people, and that is our mission here at NeuroGlow. And so yeah, with that, I want to thank you so much, Trevor, for joining us. Audience, Thrive members, thank you so much for being part of our program. If there's anything that you would like to discuss with us or me directly, please do reach out. And we want to wish you the best and have a great rest of your day. And we will be back next month with another exciting installment from Trevor.
Awesome.
So thank you. We'll talk to you guys later. Have a great day. Bye-bye.